Good evening, all. Today, as May 17th is observed as World Hypertension Day, we all have gathered here to create awareness for hypertension, which is a leading cause for cardiovascular deaths. Hypertension can be controlled and cured if we take right actions at right time. Today, our invited guest is Dr. Harshal Pandve, who will provide his insights on prevention and control of hypertension. It is a step in helping us to understand the disease, raise awareness, and acknowledge the dangers of hypertension. Before commencing the talk, I would like you to introduce to the Pune Knowledge Cluster. Pune Knowledge Cluster Pune Knowledge Cluster is been established by Office of Principal Scientific Advisor to Government of India in 2020 under the City Knowledge and Innovation Cluster Initiative. PKC, that is Pune Knowledge Cluster, is one of the 6 clusters in India, and it is hosted by Inter-University Center for Astronomy and Astrophysics in Pune, known as IUCA. Our vision is to bring together academia, R&D, institutions, and industry to address problems of the regions through innovative means using scientific knowledge and skilled resources. Mission is to act as a catalyst to bring together various stakeholders of Pune and work together on projects of importance and value to the region. The role of PKC is citizen engagement, multi-organizational science and technology-based projects, planning and strategy for decision makers, technology and innovation adoption. We have built various partnerships and stakeholders who we work closely with. We cover the entire landscape from funding bodies, academic and research organizations, industries, societies, and associations, government bodies, incubation centers, NGOs, R&D labs, and international organizations. PKC's focus areas are sustainability and environment, sustainable mobility, health, big data and AI, capacity building. Within health vertical, we do collaborations with academic, industry, NGOs, and government departments in generating data critical for public health decisions. We under PKC, under health vertical, work on disease surveillance, and we supported the state during surveillance of COVID pandemic. Sustainable mobility, apply scientific and technical tools to address rapidly growing and changing mobility requirements of the city. Citizen Science Program is an interactive web-based platform that encourages citizens to participate in big data and AI analysis. Sustainable and environment focus on securing water, food, and livelihood through carbon sinks and promoting green energy. In our capacity building vertical, we collaborate with institutes across Pune to new opportunities and improve the knowledge base students, researchers through interdisciplinary training and programs. Our leaderships, Professor Ajit Kembavi is our principal investigator, who is Professor Emeritus IUCA and ex-director of IUCA. Professor L.S. Shashidhara, who is a co-principal investigator. He is Dean of Research, Professor Biology, Ashoka University, IISER, and he is also affiliated to IISER Pune. Professor Somik Rai Chaudhary, Director IUCA, PKC Implementing Organization. Dr. Mashirkar, he is a chairman and our steering committee. Ms. Rashmi Urudvarshe, who is a senior advisor PKC, President SAE India, ex-director ARAI. Ms. Anita Kane, senior advisor PKC, CDO PMC, ex-employee from PCS, and Dr. Priya Nagraj, who is our Chief Operating Officer, PhD Biology, University of Virginia. Under health vertical, we are three of us who coordinates for all the project. Priyanki Shah, our project manager, myself, Purnima, assistant project manager, Niharika Gokte, research assistant. For additional information on our health projects as well as on other verticals, you can visit our website and connect through us to the Twitter, Facebook, or LinkedIn handles. This is about PKC. Now, I would like to introduce to you to our guest who will be providing us his insights on hypertension. Dr. Harshal Pandve is professor and HOD at Pimpri Chinchwad Municipal Corporation's Yashwantrao Chauhan Memorial Hospital and Postgraduate Medical Institute, Pune. He has been a expert working group member of different organizations. Currently, he is Joint Secretary of Indian Public Health Association, Maharashtra State Chapter. Dr. Harshal has 160 articles to his credit, which are published in various indexed international and national journals. The talk today Dr. Harshal will be providing us will be for 40 to 45 minutes. We'll have a question and answer sessions at the end of the talk for 10 minutes. We'll be sharing you a feedback link and you can share your suggestions, questions in the chat box as well. This talk will be recorded. Now I would like Dr. Harshal to commence with the talk.
Hello, am I audible?
Yes, sir.
Yes, sir.
My screen is visible to you?
Yes, sir, we can see the desktop screen.
So at the outset, I'm really grateful to Pune Knowledge Cluster for giving me an opportunity to talk on this very important topic, that is hypertension. And today is World Hypertension Day. So being a preventive medicine specialist and a public health expert, my talk will be more on preventive aspects and as well as the public health initiatives taken by the government of India and other important organizations. So I am starting my talk. My slides are visible?
No, sir. We could only see the pictures and PPT. We can't see the entire
presentation.
Hello?
No, sir. We can't see it. Can you please try it again?
Yeah. I'm trying again.
Yes, now it's visible.
Yes. Thank you. So I'll start my talk. Contents of my talk are as follows: a little bit of background of hypertension, problem statement, both global as well as Indian scenario, signs and symptoms of hypertension, including the complications of uncontrolled hypertension, the risk factors or causes for hypertension, more importantly, the prevention and control of hypertension, along with that, a small talk on World Hypertension Day 2022. And lastly, some of the interesting facts related to hypertension. So we all know hypertension, also known as high blood pressure, is a common condition in which the long-term force of the blood against your artery walls is high enough that it may eventually cause health problems. Our blood pressure is determined both by the amount of blood our heart pumps and the amount of resistance to the blood flow in our arteries. The more blood our heart pumps and narrower our arteries, the higher our blood pressure. We all know that blood pressure is given in two numbers. So the top number, which is also called as systolic pressure, this systolic pressure measures the pressure in our arteries when our heart beats. The bottom number is called as diastolic pressure. This number measures the pressure in our arteries between two beats. So it is usually given as 120 by 80, like that. So these are the categories of blood pressure. Normal blood pressure is systolic blood pressure 120, less than 120, and diastolic blood pressure less than 80. Elevated blood pressure is called as when your systolic blood pressure is between 120 to 129 mm of Hg, but it is still less, diastolic pressure is less than 80. High blood pressure or hypertension stage 1 is called when the systolic blood pressure is between 130 to 139 mm of Hg, or the diastolic blood pressure is between 80 to 89 mm of Hg. High blood pressure stage 2 is called when the systolic blood pressure is 140 or higher, or a diastolic blood pressure of 90 or higher. And hypertensive crisis, that is where it is a medical emergency when your systolic blood pressure is higher than 180 and or your diastolic blood pressure is more than 120. So what is the problem statement? Hypertension is a serious medical condition and it can increase the risk of various heart, brain, kidney, and other diseases. The diseases related to heart, brain, kidney. As per WHO, an estimated 1.28 billion adults aged between 30 to 79 years worldwide have hypertension, and majority of them are living in low and middle income countries. An estimated 46% of adults with hypertension are unaware that they have hypertension. So it is a considerable number where people don't know they have hypertension. 1 in 4 men and 1 in 5 women have hypertension globally. Less than half of the adults, that is around 42% with hypertension, are diagnosed that they have hypertension and are treated. Only 21%, that is 1 in 5 adults with hypertension, have their hypertension under control. Hypertension is a major cause of premature death worldwide. Now, World Health Organization is having 6 various geographical regions. Among these 6 regions, the Africa region has highest prevalence of hypertension, that is 27%, followed by Eastern Mediterranean region with 26%, closely followed by Southeast Asia region where our country is there. The prevalence is 25%, followed by European countries where prevalence is 23%, followed by Western Pacific region 19% and America region 18%. And the global average of prevalence of hypertension is 22%. What is the scenario in India? So India is home to 199 million adults with hypertension. That is almost 20 crore. Sorry, 20 crore adults in India have hypertension. Hypertension is one of the most important drivers of rising mortality and disability associated with cardiovascular diseases in India. hypertension is soon turning out to be one of the most lethal diseases in India. We have 29% people in India who are hypertensive, and by 2025, we'll be having 214 million adults with hypertension in India, and 1.5 million people die due to hypertension in Southeast Asia region each year. If we look at the urban and rural difference, urban area has higher prevalence of hypertension, that is 33%. Even the rural area, the prevalence is increasing and it is now at 25%. If we look at this map of India, we can clearly see that the state of now the Union Territory of Jammu and Kashmir and most of the Northeast states have prevalence of hypertension between 15 to 25. Most of the states in India, that is western part, including Gujarat, Maharashtra, central India, Madhya Pradesh, Chhattisgarh, Orissa, eastern part, that is West Bengal. Of the South Indian states, excluding Kerala, have prevalence of hypertension between 10 to 15. So it is really an alarming picture. It is the hypertension is prevalent in almost all the parts of India now. Now, what are the symptoms and signs of hypertension? The main issue related to hypertension is there are no warning signs or symptoms of hypertension. The person may be having hypertension, but he does not have any symptoms or signs related to hypertension. That's why it is called as silent killer. It is doing its work silently. It is damaging various organs of our body, but the person does not know that he is suffering from hypertension. When symptoms do occur, the most of the time the person will have early morning headache, sometimes nosebleed, irregular heart rhythm, blurring of vision especially, and buzzing in the ears. But these are not very specific symptoms, so people tend to ignore these symptoms. When there is a severe hypertension, where your blood pressure is above 160 or above 100 diastolic or above 160 systolic, the person can have the following symptoms like fatigue, nausea, vomiting, confusion, anxiety, chest pain, and muscle tremors. So this slide is showing the common symptoms of hypertension, which I have already discussed. Now, most of the time, patients or the people don't know they are having hypertension. They only come to know when they have some complications due to uncontrolled hypertension over the period of time. So the main complications of persistent high blood pressure, there are some certain target organs for hypertension we call. Most importantly, the brain, the cerebrovascular accident or stroke or hypertensive encephalopathy. Then it will affect eye, especially the retina, leading to hypertensive retinopathy. And if it not diagnosed or not treated properly, it may lead to blindness also. Heart is very important organ, and the persistent hypertension may lead to myocardial infarction. In common language, we call it as a heart attack or hypertensive cardiomyopathy leading to heart failure. Another important organ, target organ for hypertension is kidney. Hypertensive nephropathy and leading to chronic renal failure. Now, how we diagnose hypertension? The only way to diagnose hypertension is to have a health professional measure your blood pressure. Having blood pressure measured is a very quick and painless procedure. Although individuals can measure their own blood pressure using automated devices, an evaluation by health professional is important for assessment of risk and associated conditions. Now, what are the causes or risk factors for hypertension? These causes or risk factors can be divided into two types. The more important ones are modifiable risk factors, which we can modify by simple lifestyle changes. These include the unhealthy dietary habits, which include excessive salt consumption, diet high in saturated fats and trans fats, low intake of fruits and vegetables, that is low intake of dietary fibers is one of the very important cause. Physical inactivity or sedentary lifestyle is another important risk factor. Consumption of tobacco, any kind of tobacco, that is even smoking or chewing tobacco, and consumption of alcohol is also an important risk factor for hypertension. Obesity or overweight is another important risk factor related to hypertension. And the most important one is stress, psychological stress leading to hypertension. So here in this image, you can see in the first image that person is definitely having a central obesity. His plate is full of food which is very high in salt as well as in fat content. He is having a mug of beer in his hand, which is another very important risk factor for hypertension. Smoking as well as the chewing tobacco. And in rural parts of India, we have seen, and many research papers are also available, most of the people use the burned dried tobacco for cleaning of teeth. That is called as masheri in Marathi, which is a very important risk factor for hypertension. And we know stress has become a very integral part of our lives. Stress is increasing in last 2 years of COVID-19 pandemic. It has increased a lot. The reasons behind that, we all know. The news, the breaking news, which is breaking our head and giving us a lot of tension, as well as the social media, the various kind of fake information or incomplete information leading to stress. So this is also an important risk factor for modifiable risk factor, important modifiable risk factor for hypertension. The non-modifiable risk factors, those we cannot change, include age. With increasing age, our blood pressure tend to increase. And especially above the age of 40, it is very important that every adult above the age of 40 should check their blood pressure very often, so that after 40, the chances of having hypertension increases much. Another important factor is genetics or our family history. The children of hypertensive parents have a very high chance of getting hypertension in adulthood. So if your parents are having, or any of your close blood relatives are having blood pressure, it is better that you should screen yourself for hypertension, so that you can come to know at the earliest and the preventive measures can be taken at the earliest. Ethnicity is another important risk factor, especially the Black or Negro population has shown higher chances of hypertension compared to other ethnic groups. Gender is also a risk factor. In initial years, the males have more chances of elevated blood pressure, and also their chances increase after the age of 40 years. Females in the early age do not show hypertension, but at the menopausal age, there are higher chances of uh, hypertension in females. So both males and females are at the higher risk of getting hypertension, but at different age groups. So both should get them screened at the age of 40, and the menopausal age women should get at the age of around 50 for screening of hypertension. Now, prevention, as I am professor of preventive and community social medicine, I'll be talking more on this topic, that is prevention. So it is very easy to prevent hypertension. Reducing salt intake to less than 5 grams daily is very, very important. We have a tendency of taking extra salt in our any food item. In only Indian dishes, we can see salted is food is one of the components of your dish. That should be stopped, because when the salt is available, person is tend to take the extra salt in dal or in any vegetable, any curry. So that habit should go. That any extra portion, any portion of salt should not be put in the dish itself. Our dish should be very colorful ones with different types of vegetables, green leafy vegetables, or salads including cucumber, tomato, or carrots. And the more fiber diet we should include in our day-to-day dishes, and completely stopping or keeping at the minimum the junk food. Especially, I would like to tell to the younger, the youth population, the younger population, where the tendency of having junk food is more, and it is also easily available now due to various food delivery platforms. So avoiding this is very, very important. There is something called as dietary approach to stop hypertension. Dash. So this is a representative picture of DASH diet, where you can see that the majority of our dish should contain the vegetables and the seasonal fruits, followed by the whole grain or and whole grain products. Then we can have low fat or non-fat dietary food items, dairy food items, which are now available with most of the uh, dairy product companies. Then followed by the lean meat. Especially, I would like to say that fish is a very good source of protein that should be included. It is again protective against various cardiovascular diseases. And the followed by the poultry items. One should avoid the red meat, and also nuts and seeds should be included in our diet. So this is DASH diet. You can see on Google it as a DASH diet, and you can get more information about it. Now, exercise, any kind of exercise, whether it is brisk walking or jogging or trekking, swimming or cycling, even dancing, is very important for prevention of hypertension. It is said that one should have at least 150 minutes of rigorous or strenuous exercise in a week. It comes to around 30 minutes per day. And a simple rule of thumb is that when you do any exercise, whether it is brisk walking or cycling, at least back of your shirt should get wet with your sweat. That is an indication that you had a good session of exercise. Now, completely avoiding the use of tobacco is very, very important. Any kind of tobacco, whether it is chewing tobacco or smoking tobacco, complete avoidance of the same is very important for prevention of hypertension. People say that alcohol is good for heart health or something like that, but I would like to tell that a very small quantity of alcohol, and that is to uh, wine or red wine, can be having a beneficial effect, but most of the time the alcohol is harmful, not only related to hypertension, but many other health problems are related to alcohol. So completely avoiding alcohol is advisable. Stress management, a very important aspect as far as prevention of hypertension is concerned. But one type of stress management cannot fit for everyone. Like I myself like music, I like to paint or write something, and I like to take a walk in the nature. So same is not advisable or is not liked by everyone. So there are many stress management techniques which are available. Most of them are also available on mobile phones, like various meditation techniques, uh, meditation music, stress management music, or you can also go for other things like exercise or spending talking to your friends. The only thing is that your friend should not increase your blood pressure. That is very important. So you can choose any of the technique which suits you for prevention of hypertension. Now it is very important in the management point of view, if you are diagnosed with hypertension by your doctor or a physician, it is very, very important to regularly check your blood pressure. You can check it by visiting a health facility, or you can also keep a journal of your blood pressure at home. Many automated devices for checking of blood pressure are available now. So you can check regularly, at least once in 3 to 4 days or once in a week, what is your blood pressure. You should keep a journal of that. And if you see any changes in your blood pressure, whether it is rising or whether it is decreasing, you should always consult with your consulting physician or doctor and take a proper advice about your medication. Hypertension is itself is also a risk factor for many other non-communicable diseases like diabetes. So it is also very, very important to manage your other comorbid conditions like diabetes. Regularly checking your blood sugar levels, keeping journal of that, and consulting your physician or diabetologist is very important, because the combination of diabetes and hypertension is very common nowadays, and which also leads to greater chances of various metabolic complications. Now, I would like to also talk about in the public health point of view regarding our response, India's response so far to not only to hypertension but important non-communicable diseases. So, the government of India has taken cognizance of the epidemic of non-communicable diseases in India, and in January 2008, Government of India has launched a national level program, that is National Program on Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Stroke. Though it has not included the name of hypertension in this program, but it is very much there, because hypertension is important non-communicable disease, as well as hypertension itself is a risk factor for other non-communicable diseases. So all these non-communicable diseases are included under one umbrella program because they have common risk factors, as well as the prevention and control strategies are also common. So the government of India has implemented this program up to the district level under National Health Mission. And the program focus on awareness generation for behavior and lifestyle changes, screening and early diagnosis of the person with high level of risk factors, and their proper referral to appropriate treatment facilities. Health promotion through behavior change communication is a very important aspect of objective of this program, and screening at all levels in healthcare delivery system, right from the primary care level of subcenter to primary health center to tertiary secondary health care to tertiary care. Screening is a important integral part for early detection and prompt treatment of non-communicable diseases. Now, under the strategies, health promotion, awareness generation, and promotion of healthy lifestyle is important. With screening and early detection, timely, affordable, and accurate diagnosis of the non-communicable disease, access to affordable treatment. Usually, the treatment of non-communicable diseases is quite costlier one. So, it should be affordable to all the strata of the society. And if some complications has happened due to non-communicable disease, appropriate rehabilitation of the patient is also one of the strategies under this program. This is the infrastructure so far till March 2020, which is available on the website of this program at various levels. Population-based screening program is very important initiative under this program, and especially for diabetes and hypertension and common cancers like our in India, oral cancers, breast cancers, or cervical cancers are common. So this population-based screening has been expanded to more than 400 districts of India. The grassroots level workers of like ASHA, accredited social health activists, and auxiliary nurse midwife, which are working at sub-center level, are the backbone of this screening program. And also at the very basic level, Government of India has devised one NCD app where all the data and further follow-up of all the patients can be taken. Under Ayushman Bharat, NCD are included in spectrum of services being offered at health and wellness centers. And also looking at the complications leading to renal failure, this Pradhan Mantri National Dialysis Program is also implemented under this program. Another important initiative I would like to mention here is India Hypertension Control Initiative, which is in collaboration with World Health Organization. It is strengthening hypertension services and performance measures using simple app in India. It was launched in November 2017 as a pilot project in one of some of the states in India. In phased manner, it will be implemented all over the country, and it is based on the WHO HEARTS package. And the partners in this initiative are Ministry of Health and Family Welfare, Indian Council of Medical Research, WHO India country office, state governments, and Resolve to Save Lives. They have devised one app that is simple app, which is available with the primary health centers as well as with the grassroots level health workers, where they can register the patient of hypertension, they can keep the follow-up of the patient on that time. And even if the patient misses the visit to the health facility, uh, this app is very helpful. We can talk to the patient, or we can go to the house of the patient asking him why he is not reporting for follow-up, and the measures to take him on the treatment and the regular follow-up can be taken. Some other initiatives related to non-communicable diseases at the national level. These are as following. The Comprehensive National Nutritional Survey is the first ever national nutrition survey covering more than 1 lakh preschool children as well as school-aged children and adolescents in rural and urban areas across 30 states of India. This survey provides national and state level representative data for nutritional status and micronutrient deficiencies among children and adolescents from birth to 19 years, and also gives the estimates of biomarkers for non-communicable diseases among those aged between 5 years to 19 years. So these kind of surveys are very, very important for prevention point of view. Another important initiative that is called as the Eat Right movement. To improve public health in India and to combat negative nutritional trends, to fight lifestyle diseases, the Food Safety and Standard Authority of India, that is FSSAI, launched the Eat Right movement on 10th July 2018. The food industry, public health professional, civil society, and consumer organizations, influencers, and celebrities came together on common platform and pledged to take concrete steps to amplify the Eat Right movement in the country. As we all know that food habits cannot change overnight, it takes a lot of conscious steps to avoid unhealthy dietary behavior. In order to instill confidence among citizens that even a small change in the diet can bring about positive, significant change on their health, FSSAI initiated nationwide social media campaign called as Aaj Se Thoda Kam, starring the well-known Indian actor Mr. Rajkumar Rao. I hope you must have seen him in few popular movies like Newton. So I have also given here the YouTube link for this campaign, and I would like you to share it with your friends, your colleagues. It is a very, very effective video, and it can be used for uh, reducing salt, sugar, and fat in our daily diet. Another important movement that is known as Fit India movement is a nationwide movement in India to encourage people to remain healthy and fit by including physical activities and sports in their daily lives. It was launched by our Honorable Prime Minister of India, Sri Narendra Modi ji, at Indira Gandhi Stadium in New Delhi on 29 August 2019 on the occasion of National Sports Day. Our Prime Minister, as we all know, himself is a fitness enthusiast, and he has observed, or he has mentioned, that the root cause of most lifestyle diseases are lifestyle disorders, and there are many diseases that can be overcome by making small changes in our lifestyle. PM Modi stated that lifestyle diseases like diabetes and hypertension are increasing in India, Hence, the Prime Minister said that Fit India should be seen as household movement, a daily routine. Prime Minister said, and I quote, only a fit person, fit family, and a fit society will pave way for a great and new India. So at the national level, the central leadership at the highest office, the non-communicable diseases are taken very, very seriously, and various campaigns, various initiatives are already started. So that is a very good and significant step. Another important initiative I would like to mention here is My Thali initiative. My Thali addresses the most common challenges to healthy eating. People are confused about what to eat and in what quantities to eat. So this My Thali teaches people about the importance of the portion, that is food nutrition, as well as the adequate portion. It is inspired by the United States My Plate approach, and it has been translated into India's National Institute of Nutrition, that is NIN, Hyderabad guidelines into an easy to follow picture. So one of the representative picture I have put here, it is a lunch, a thali of a lunch of a woman who is heading a sedentary lifestyle. So how much vegetable, that is 1 cup of vegetable she could take, half cup of salads, then proteins in uh, that is dal or sambar, or one piece of meat, then curd, half cup, 1.5 chapatis, the chapati size also given, and small bowl of or 1 cup of rice. That is the carbohydrate in our day-to-day diet. So similarly, various kinds of dishes are given on this website, which is mentioned here. You can go through this website and you can see for the various type of dishes given, and you can also ask your colleagues, friends, near and dear ones to visit this website and follow this. Now coming to the World Hypertension Day. World Hypertension Day is a day designated and initiated by the World Hypertension League, which is itself an umbrella to organizations of 85 national hypertension societies and leagues. The day was initiated to increase the awareness of hypertension. This was specifically important because of the lack of appropriate knowledge among hypertensive patients. The World Hypertension League launched its first World Hypertension Day on May 14, 2005. And since 2006, the World Hypertension League has been dedicated May 17 of every year as World Hypertension Day. That is today, May 17. This World Hypertension League is an affiliate of the International Society of Hypertension, initiated the World Hypertension Day in May 2005. Ever since then, it has become an annual event proceeding for increasing blood pressure awareness and prevention of related deaths. The league comprises of leading scientists, doctors, and allied health workers who share common interface in hypertension research, prevention, and control. Every year, volunteers all over the world participate in global awareness campaign that is called as May Measurement Month, initiated by International Society of Hypertension in 2017, to help the people living in villages and in small towns in measuring and monitoring their blood pressure and counseling them on preventive measures. Now, World Hypertension Day 2022 is today, and the theme of this year is measure your blood pressure accurately, control it, and live longer. It focuses on combating low awareness rates worldwide, especially in low and middle income areas, and accurate blood pressure measurement methods. To increase awareness of hypertension, there are two critical components. First is establish high capacity community screening programs for recognition of high blood pressure in those at risk, and promote routine measurement of blood pressure by healthcare professionals at all clinical encounters. That is also called as opportunistic screening. Whether a person is coming for any ailment, whether it is fever or cold, cough or any other, the blood pressure should be mentioned, taken by the healthcare provider. And if the person is showing higher blood pressure, he should be properly counseled, and if required, the proper medication can be started. An important initial step for control of hypertension and achievement of United Nations 2025 goal for 25% in reduction in uncontrolled hypertension is to improve hypertension diagnosis. So this is the poster of this year World Hypertension Day. Again, I will tell the theme: measure your blood pressure accurately, control it, and live long. Now, I would like to just share some of the interesting facts about hypertension in a very short time. There is something called a rule of halves. You can see the circle which is denoted by A, which is the total population of some country or some area, whatever you take. B denoting the hypertensive population. Okay, but actually only C, that is the population which is symptomatic hypertension. Of this symptomatic hypertensive population, the D is denoting the diagnosed hypertensive population. Then the E is denoting the hypertensive of diagnosed hypertensive population which is treated, and F is denoting the treated hypertensive population which is adequately treated. So you can see that the majority, we have already discussed, more than 50% or around 50% of the hypertensive population is not aware that they are having hypertension. Those having hypertension, only 50% of those are treated, and of those who are treated, only 50% are adequately treated and their blood pressure is under control. So this is very important concept that is called a rule of halves. This is a picture of iceberg. Most of us have seen the movie Titanic, and the iceberg was responsible for the accident which has happened to Titanic. So the important aspect of iceberg is that the only a small portion, maybe around 20% of the iceberg is visible to the eyes, and most of the iceberg is below the waterline, which we cannot see. So in hypertension, only those who are having some symptoms are get diagnosed, or they visit the healthcare facility and get diagnosed for hypertension, or those who are having complications of persistent hypertension over the period, and they land up in some complication and then they visit to the healthcare facility, they can be seen by the physician, like here this portion is seen, but the majority of the portion is below the waterline. We cannot see this portion, and this portion represents the asymptomatic or mildly symptomatic hypertensive patients. So this is another important phenomena which is related to iceberg, the hypertension, that is called as iceberg phenomenon. It is also seen in some of the other diseases also. There is something called as tracking of blood pressure. Okay, blood pressure elevation is much more common among children and adolescents than previously thought. Moreover, blood pressure in childhood correlates with blood pressure in adulthood. Very important statement. Blood pressure in childhood correlates with blood pressure in adulthood. Hence, the children with elevated blood pressure have a greater probability of developing hypertension in adulthood than the children with lower blood pressure. So this tracking of blood pressure concept is very, very important for secondary level of prevention. If we follow the children with higher blood pressure in childhood over the period of time, we can easily detect them at the earlier stage so that they cannot develop, they should not develop hypertension in adulthood, and we should give them proper counseling for various lifestyle changes which are important for prevention and control of hypertension. On a funnier note, there is something called as white coat hypertension. It is a syndrome whereby a patient feeling of anxiety in medical environment resulting in an abnormally higher reading when their blood pressure is measured. Okay, usually those who are not familiar with hospitals, who are not doctors or healthcare providers, whenever they visit any healthcare facility, and if we take their blood pressure, it is likely to be higher. It is due to the anxiety they feel in the medical environment. So the proper way to take hypertension is that we should relax the patient first, take the blood pressure. If the reading seems to be higher, again for 3 to 5 minutes, the person should be calmed down. He should be quietly sitting, and then again we can take the blood pressure once or twice more. And the lowest value of these three readings can be taken as the blood pressure of the person. Another interesting fact is that a recent Harvard study finds that eating a small square of dark chocolate daily can help lower blood pressure for people with hypertension. But again, I would like to mention that it is clearly mentioned small square. Okay, you know how the squares are there in the chocolate. So very small square, 1 or 2 squares only, and that too of a dark chocolate. There are n number of chocolates which are available in the market in the name of dark chocolate, but we have to search for a dark chocolate. And a very small portion of dark chocolate is may be helpful for lowering the blood pressure. So to summarize, the take-home message from this talk, I would like to mention only 4 points. That hypertension is a silent killer. There are no symptoms in majority of the patients. Diagnosis and management is simple for hypertension. But very importantly, awareness is the key for prevention. And the hypertension can be prevented by simple lifestyle changes, which we have already discussed. These are my references for this talk. And again, I would like to acknowledge, and I'm very grateful to the Pune Knowledge Cluster, especially Purnima Madam, for giving me this opportunity to talk on this very important issue. Thank you so much. These are my details. My email address and also mobile number is mentioned here. So in case of any queries or any doubts in future also, you can contact me. So here I would like to end my talk. Over to you, Madam. Hello.
Yes, hello, sir.
Yes.
Hello.
Yes,
Hello. Yes.
we can hear you, Punima.
Yes. This is now the question session. If any questions, you can please ask all the participants.
Yes, please.
We request participant to put their questions in the chat box at the bottom tab. Punima, there is
Okay,
one.
there is a question from Anup Kumar.
Yes.
Hypertension medicines
Ha.
required to be continued for long.
Lifelong.
Lifelong. It's written long.
Yeah. Hypertension usually is an irreversible condition. So you have to control your hypertension by taking medications lifelong. It is similar to like a diabetic person need to take medicines lifelong. Similarly, hypertension is also a lifelong disorder. So better to prevent it.
Any more questions?
There are some colleagues of mine from my institute also, and also from my previous institute, that is ESIC Medical College, Hyderabad. If they would like to have any comments on this issue, these are very welcome comments. Dr. Sudha madam, are you there? Dr. Mukesh
Yes,
Bawa,
sir.
sir.
Yes, sir, I'm there, sir.
Yeah. Madam, any comments from your side on this important?
Excellent presentation, sir.
No. Regarding hypertension, I would like to take your comments also, because she is also working on this issue at Hyderabad. So,
Yes, sir.
any comments would you like to make?
Sir, as per that updated hypertension,
Yeah.
that we should make a note, sir. Because the JNC 7 on the JNC 8,
Yeah.
it's very different. And what you have given, that is more important, where
Yeah.
we need to target it.
Right, madam. Yes. Thank you so much. Yes.
Thank you, sir.
Dr. Mukesh Bawa, sir, are you there?
Yes, sir. Good evening, sir.
Good evening. Your
Nice
comments,
presentation.
your comments on this important issue, sir.
Sir, hypertension is the leading cause of mortality all over the world. Nowadays, India is topping in these two non-communicable disease, hypertension and diabetes.
Yes.
So you aptly said that prevention is very important. Otherwise, there are lot of complications of hypertension. So very good topic, sir. And on this day of World Anti-Hypertensive Day, it will provide some preventive strategies for the general population as well as the researchers. We need to focus on research related to hypertension.
Yes, sir. Yes. Very nicely pointed out.
Thank you.
I would like to take a comment from Harshal Pandve, sir, who is also attending this meeting, and he is working in the field of nutrition for last 20 years. So, sir, your comments, please.
Hello.
Yes, sir. Your comments, please. Welcome.
Fantastic presentation by you, sir. Thank you.
Thank you, sir.
It was a nice information, and everybody should be aware about our current health challenges. Especially, I recommend all people to focus on their diet. Now,
Yes.
diet is an important part nowadays.
Actually.
Thank you.
Yes. Dr. Shruti, would you like to mention something? Dr. Shruti? Dr. Shruti Gaikwad?
No one.
Dr. Varsha? Dr. Abhijit Nimbarkar is also there.
Yes.
Dr. Abhijit, your comments, please.
So if there are no comments, then can we
Yeah.
have a group photo so that, we
Yeah,
can,
yeah, sure, ma'am.
can we ask participant to please turn on their cameras so that we can click a group photo? We request participant to turn on their cameras.
We request all the participants.
Please allow.
So can you please stop sharing the presentation? So that
I have stopped, madam. It's still seen.
yeah,
We can see your
the slide.
Now,
How to open the camera? I cannot open.
Just a minute. Can we, can the participant turn on their cameras?
To
Is
open
it
the camera,
disabled? Yeah.
Just a minute, just a minute.
I cannot open.
We are unable to start the video.
Oh, okay. Wait. Yeah, now I think all the participants can turn on their cameras. Can all the participants turn on their cameras, please? We are posting all these photos on our social media handle.
Am I visible, ma'am?
yes,
Yes,
you are
so
visible.
you are visible. Yes.
Okay.
Okay. Yeah. Thank you so much. Thank you, all of you.
Thank you, ma'am.
Hello.
Yes, Purnima, we can hear you.
Yes. So thank you, Dr. Harshal, for your insights and envision on the hypertension control, awareness, and prevention. We thank you all from Pune Knowledge Cluster. Priyanki, if you would like to say a few words.
We'd just like to thank you. We really appreciate you taking the time off, Dr. Harshal, and your talk was very helpful. And I think it also emphasizes on the importance of constant monitoring and how we can regulate diseases by small changes on a day-to-day basis, whether it's diet or exercise, or how we keep track on how the disease is developing. So thank you so much. And we really appreciate you taking the time today to give us all this information that is very helpful. Thank you.
thank you, madam. Thank you so much.
Thank you, all of you. Thank you.
Thank you.
Can we leave now?
Yes, sir, yes.
Thank you.
Thank
Yes,
you.
thank you, sir.
Thank you.